Let's talk about how menopause changes your pelvic floor and what you can actually do about it. My name is Andrea Martin. I'm a women's health nurse practitioner. I am a Menopause Society Certified Practitioner and the owner of Glow Health, which is a menopause practice. So tell me if this scenario sounds familiar. Leaking when you cough or you sneeze, pain with sex, heaviness and pressure in your pelvis, maybe even joints that suddenly ache for no good reason. Most women never really connect these symptoms to menopause. They just figure, well, this is just a consequence of having babies, or this is a consequence of getting older. And sometimes it is, but sometimes menopause is also playing a big role here. Estrogen doesn't just affect your ovaries, it literally affects every part of your body, including the musculoskeletal system. So your bones, your joints, your cartilage, your connective tissue, all of it. Let us introduce you to your pelvic floor. Your pelvic floor is this hammock of ligaments and muscles and connective tissue. It helps to hold up all of your organs, so your bladder, your rectum, your uterus, it's a whole party in there. These tissues and these muscles are literally loaded with estrogen receptors, and they depend on them to stay strong. It promotes collagen and elastin production. It keeps the vaginal tissue thick and moist and increases blood flow. When estrogen levels drop, collagen degrades, the ligaments become weaker, and you lose some of that pelvic support. The vaginal lining becomes dry, brittle, and fragile. The pH rises, so it loses its protective acidity, and that puts you at a higher risk of developing urinary tract infections. That support system that's been strong and healthy and holding everything in place can start to give way a little bit. This isn't just happening in isolation in your pelvis. There's actually something called the musculoskeletal syndrome of menopause, and it affects 71% of women. Basically, it's symptoms that they can feel, but when you try to prove it and get an x-ray or imaging, there's nothing that you can actually see. There's 5 primary changes of musculoskeletal syndrome of menopause that we see, and this is how they can all kind of affect the pelvic floor. Number 1 is the inflammatory process. Estrogen is very anti-inflammatory, so when it drops, you're gonna see more inflammation in the muscles. Repair is impaired, and you can feel this as achiness, tightness, and a pelvic floor that does not recover as well as it used to. Number 2 is something called sarcopenia, loss of our muscle mass. We lose about 0.6% of our muscle mass every year after we go through menopause. So again, this can then translate into maybe poor balance, less strength, less stamina, and again, this all translates to the pelvis as well. Number 3 is satellite cell decline. These are my favorite guys, little ambulances that come rushing to the scene when there's any type of muscle injury. And they're basically stem cells that help with repair and regeneration. Estradiol stimulates their activation. When estrogen levels decline and you don't have as much of that help from the satellite cells, you might be injured more easily, and it takes a lot longer to recover. This may translate as an inability to build or maintain muscle mass, sometimes even when you're working out. Number 4 is a huge one, osteoporosis, highly underdiagnosed, undertreated, but there's really no reason that it should be. It's very easy to find. Women lose 10% of their bone mineral density during perimenopause. 70% of hip fractures happen in women, and of those who do fracture a hip, 1 in 4 are going to require long-term care. That means loss of independence, maybe being unable to live in your own home with your family, doing the things that you love to do. Actually, hormone therapy can be very helpful in preventing this or even increasing bone mineral density. This may translate for you as loss of height, maybe a stooped posture, back pain, fractures for low impact falls, or most importantly, you may feel nothing. Osteoporosis is what we call a silent disease. Most people don't feel anything. That's why it's really important that you're screened for it. Finally, number 5 is arthritis and cartilage changes. Osteoarthritis increases dramatically around menopause, and women actually can have much higher rates of pain than men do. So estrogen regulates something called chondrocytes. Chondrocytes are cells that repair the extracellular matrix. What the hell is the extracellular matrix? That is what makes cartilage strong and springy and shock absorbing. For you, this may translate as joint pain and stiffness in your hips, your back, and your knees. 1 in 4 women are going to be affected by pelvic floor disorders. Common symptoms may be urinary changes, maybe loss of continence, so frequency, urgency, waking up at night because you need to pee. There's also pelvic organ prolapse, which is that sensation of heaviness, pressure, fullness, and they can actually sink down a little bit. And then of course there's pain with sex. This is a very common one, and one that I say is a non-negotiable because we can always treat that. Sex should never be painful. Finally, there's bowel changes, whether it's constipation, or the inability to hold in your stools or gas. These are not inevitable, and I hear from women all the time, well, that's just what happens as you get older, right? No, not at all. We can prevent this. So let's come up with your pelvic floor action plan. What can we do? Number 1, vaginal hormones. These are huge and so easy and so effective. So again, using a cream, a tablet, an insert, a ring, something simple like that, which is very, very safe in restoring vaginal health, vaginal thickness, vaginal acidity, which is very important. Pelvic floor physical therapy. This is one of my most favorite things that patients can do. Find yourself a wonderful pelvic floor physical therapist. There are many of them at Intimate Rose. They can help you from the comfort of your own home. Things you didn't know about your pelvic floor. Let me tell you, they are wonderful. I have never had a patient return from pelvic floor physical therapy unhappy. They're always amazed by what they have learned and how helpful it is. How about layering in some tools and devices? So if you've got a weak pelvic floor, you can use something like a Kegel weight. Soft, flexible, it goes in the vagina, weighted. This little tail here helps you to pull it out when you're done. Using this just a few minutes a day helps your pelvic muscles learn how to re-engage and contract. If you've got really tight pelvic floor muscles that are tender and painful, especially when it comes to sex, maybe some constipation, you can use tools like a dilator, which is soft and stretchy. It helps to gradually stretch open those pelvic floor muscles, or something wonderful like a pelvic wand, which you can use to go in and massage any of those really tight, painful trigger points. If you have any of these symptoms, leaking urine, not being able to hold your bowels in, pain with sex, pelvic pressure, pelvic organ prolapse, please bring it up to your clinician. This is not something you just have to deal with. I want you specifically to ask about vaginal hormones and pelvic floor physical therapy. Those two together are the absolute dream team. Your pelvic floor supported you for decades. Now it's time to support it back. Share this with somebody that might find it helpful.